PID simply means pelvic inflammatory disease. Now, I don't hear people tell me, say, doctor, please talk about pelvic inflammatory disease. So I won't talk about them right now. You see, pelvic inflammatory disease, now infection where they affect women around their pelvic organs. Like, it will affect them for their uterus, it will affect them for their fallopian tubes, it will affect them for their ovaries. Now, the most things where I know, so you go ask me now, we say, okay, so how people can they get pelvic inflammatory disease? Okay, I'll break them down for you. Most times, the way people they get PID, now through knacking. Maybe you they knock up and down, you know, they use protection, you they do genital collision every time, just they give and collect. Yes, if you get PID, because the bacteria where they cause PID, most times we they get this bacteria through knack. How you feel know say you get PID? Hey, you see, PID for some people, it go there their body, like this bacteria go there their body. They don't go see any symptom. It go just stay there. They their body, they cause them problem. Why for some people, if you give them problem, what is the problem? So if you give them like fever, if you give them abdominal pain, lower abdominal pain, if you give them, maybe say when the woman they see her period, it go dey pain or the period go heavy, or anytime she meet her partner, you go dey come dey pepper am, dey pain am anytime she knack, or even after she knack, she fit see blood. Some women go get PID and they will get discharge. This discharge get bad smell. This discharge get some kind of wicked color. These ones and some many other things, they among the symptoms of PID. Make we talk about the treatment of pelvic inflammatory disease. So the treatment of pelvic inflammatory disease, now the use of antibiotics. Yes, antibiotics. If you want to know the name and the drugs to use, what do you make you do? Make you go see your doctor. Guy, talk the name now. Tell us the name. Calm down. Social media, you know they prescribe for social media. It no good. Before you go collect rubbish medicine, like we enter one chance. If you get problem, I beg you, go and see your doctor. This platform now to just teach and teach you alone. Now, when you treat yourself for PID, some things they very important to make you know. What in between me you know, be say when you treat yourself for PID, as you follow your doctor advice, if you start medicine, I beg you, no stop am. Number 2, no dey knack. Allow yourself finish treatment before you go back to knacking. And then your partner needs to collect the treatment too. Because you get how you go dey treated finish now for this PID. You go back, go meet your partner. Your partner carry fresh one, put for your body again. Because sometimes your partner no go get symptom. And you no go know say your partner and they can't give you. So if you get PID and you dey on treatment, they good say you and your partner they collect the treatment, may you no go they do reservoir collecting. That one they very important. Now PID, if it cause you some complications, what will be the complications of pelvic inflammatory disease? Remember, say I tell you say this infection will affect your tubes. Now if your tubes get infection for a very long time, this infection will cause your tube to block, because it go form scars, fibrosis will come dey inside the tube. We can't block the tube. Egg no go fit pass. If it can cause you infertility problem, that's one. Sometimes this tube matter. If it still cause you ectopic pregnancy, that's one day. Sometimes for some women, this infection can cause them to get abscess. That is, the body go just gather small pus or like fluid inside their body. For some women, these things can cause them to get pain every time. That place just they pain you, belly pain every time, lower abdominal pain, despite the fact say you dey collect treatment. Now, after I don't talk all these things, how you fit prevent yourself from PID? I beg you, if you want the knack, make sure say you dey use your sense knack. Use CD. Make sure say you and your partner una dey screen una self for infection. And then when you get problem for your body, no dey run go buy medicine, because if you go buy medicine now, you go take the wrong medicine, you can't dey suffer in the future for waiting you no know. Remember, like I always tell you, good life na sense. Click on the follow button if you know say you want to learn more.